Poor 50-year-old Dirty Edward, who rides with the Dirty Ducks Biker Club, is severely frustrated with his new diagnosis of colorectal cancer because he can no longer ride with the boys until his treatment is over, which will be surgery. After old Dirty Edward's last checkup with the doc, he has recently found out he has stage 2 colorectal cancer. Edward has started to notice a change in his stools and got really concerned when he started noticing bleeding.
Normal functioning and system. The colon is made up of 4 parts: the ascending, transverse, descending, and sigmoid, which then attaches to the rectum. The large intestine contains 3 layers: serosa, submucosa, and mucosal layer. It also contains smooth muscle of circular and longitudinal to help move digested food out of the body. The large intestine also contains goblet cells, which produce mucus to help ease the passage of feces and protects the intestinal wall from irritating acids and gas release. The main functions of the large intestine are to recycle water back into the body for solid stools and absorb any leftover nutrients from digested food. It does this through diffusion. It then makes digested food into feces by the mixing of bacteria, mucus, and digested food. It will also store the feces until it is removed by the rectum. Some risks include age, around 50, genetics, rare autosomal dominant trait linked to the mutation on the long arm of chromosome 5, physical inactivity, polyps in colon and rectum, high intake of red meat. Mutagenic amines can be found if meat is cooked at too high of temperatures, and carcinogenic compounds can be found in smoked and salted meats. Laxatives do not cause colorectal cancer.
Some symptoms in colorectal cancer include rectal bleeding, stomach pain, changes in bowel patterns, distension, and sound, either no sound, high-pitched sound, or decreased sounds. One of the most common screening tests for colorectal cancer is the fecal occult blood test. This checks for hidden blood in the stools that have been released from polyps. This test helps to detect edematous polyps. Treatments. Surgery is the primary treatment for colorectal cancer, but chemotherapy and radiation may be used to help control symptoms. Proteins. The cells within the colon mutate, creating excessive cell growth that result in polyps. Polyps are benign growths protruding from the mucous membrane. As the cells continue to divide and multiply, the polyp enlarges and thus becomes an adenoma. Cell membrane. The large intestine cannot absorb water and nutrients through diffusion due to the blockage caused by tumor. Homeostasis. The feces within the large intestine cannot smoothly pass due to partial or full obstruction of the bowel. Partial obstruction happens in earlier stages when fecal matter can become caught on polyps, causing temporary bowel obstruction. In summary, proteins. The cells within the large intestine mutate, creating polyps. If mutations continue, these polyps become adenomas. Cell membrane. The large intestine cannot absorb water and nutrients due to the blockage caused by the tumor. Homeostasis. Feces cannot pass smoothly through the large intestine due to partial or full obstruction.
After Old Dirty Duck's surgery, he will need some bed rest before he's back on the road with his boys.